another. It's called an elevated first rib, and we typically call it an elevated first rib because usually the high side is the stiff side. A lot of people will say one side's dropped and I need to fix that, and it can be that, but there's a simple test to do for this. If you press down and that side is more mobile, and you press on the other side and it's less mobile, it's the side that is less mobile. In this case, it is the patient's right side that is elevated. If you look at my two hands, you can see that is up. So, especially if you're at home, you're lifting weights and you're videotaping yourself and you're looking at your form, you'll often see that maybe your shoulder can't come down when you're doing, say, your squat or you're doing some of your lifting. And so you can see in the video that your posture is not a problem. So the structure that causes that, as I said, is an elevated first rib. And so the first rib head is there, and then actually you come back to here, you can see the back side. First rib. So here's the first rib head in the back. There's the spine, transverse process, and rib. So we have to grasp the rib. Now the action is going to be that I'm going to be pulling the rib forward and into this, because an elevated rib is usually that way because the muscles that elevate the rib, hold it into inhalation, have fired and stuck the rib in that position. So I'm going to try and get it to go into what we call an exhale position, forward and down. So you side bend towards, side bend the head towards, rotate away. You can do this on yourself. I'll demonstrate in a moment. I'm going to apply pressure towards the camera here. I'm going to ask the patient push to the left for me, please. So as she pushes, I now push forward, and the rib begins to move. Now I don't let go of my forward pressure with this right hand. I hold the, she pushes her head to the left for 8 seconds. Go ahead and relax for me. You might stretch it. You can see that she can't really move away from this side. I'm going to reposition my hand. Okay, side bend towards, slightly rotate away, push to the left for me. Pushes, I push, I hold, I ask her to relax, I move her neck around. Okay, side bend towards, rotate away, push to the left. Usually 3 times is the magic number of times. That's, you're going to get the most out of it in those 3 times. And there we go, and let it go. Okay, and you want to move the head around and kind of make it go crunch. Okay, and what you're going to see, you're going to see that my hands are much more level now. You can see that. There we go. Much more level. Now, that doesn't fix the whole problem. There's a clavicle problem, and this will cause rotator cuff impingement, so the infraspinatus muscle in the back. So we're going to look at, like, say, pec minor, or pec minor is okay. Now, the subclavius muscle is going to be part of this. It's the muscle that's up and under the clavicle, or the collarbone. And you can see that her collarbone is very tight. Now, why that's involved is because that first rib was in the wrong place. The subclavius attaches the collarbone to the first rib. So you have to get your fingers up and under. So when you're at the gym, you'll still see people with the 2.5-pound weight and they're trying to do this to loosen up their shoulder. What would be more effective for them to do is to push their fingers. And again, it's up and under. So if you push straight back, you're not going to find it. It's not as tender. But you can see the look on her face when I really hit that thing there. I can't, but you can. It's not pleasant, and you want the not pleasant area because it tells you that the muscle is not functioning. Okay, so you can hold that pressure there. Let's have you internally next time. I'm going to teach your arm. Bring it up to your side. There you go, and then just flip it in and out. There you go. So as she does that, that mobilizes that muscle, forces it to work, and then come on back down by your side. Okay, and then actually do big circles with your right arm for me. There you go. So as they do circles, now you can do this to yourself, right? And so you're probably going to want to. There we go. And you can see, not as much fun, but, okay, and then take a break. All right. So you can see that that's what we're after. And we're trying to get that arm to be much more mobile. And that the arm, now when I press down on that arm, or that shoulder, it's much more compressible. It has a spring to it, whereas now this side does not. The left side does not. So, of course, we would follow that right up by doing the other side now. You can have an elevated rib on one side and then find you actually have an elevated rib on the other, which was the low side originally. Okay, and then side bend towards, rotate away, push to the right for me. I'm going to push towards the camera. 8 seconds, and let it go. Maintaining my pressure, really trying to get that first rib to mobilize. Side bend towards, rotate away, push to the right. Not too hard. It's not about how hard they do, just enough to fire the muscles to get the scalenes attached to the first rib, the anterior middle scalene attached to the first rib. That's what actually does the release. And let it go. So that's why we're using the head. There we go. I felt a little clunk on that. We're going to still do our 3rd time just because of the neurological aspect of this. control of the muscle. Muscles don't do anything on their own. They do what they do because of nerves. And relax for me. All right, there we go. We feel like we got much more. I'm going to really side bend that. You can tell that she has just a lot of tension in this upper body. So we would actually now go on to the second rib, and I do basically the same thing at the second and third ribs on both sides. So we did the first rib, elevated first ribs. She also has elevated second ribs, which is what made her such a great candidate for showing this video. And you can see just all the way through the back, I'm compressing into the ribs, trying to mobilize them into the anterior posterior direction. So you at home might lay on a ball or have a ball against the wall and lean against it. And so you could side bend towards, rotate away, and then push against that ball, and it's in the wall, so that it pushes the rib towards you, towards the camera, and push to the left. And so you can do this all by yourself. And let it go. There we go. So you can see that her shoulder, slowly but surely, is giving. Push to the left. So yeah, lean against the wall, ideally a lacrosse ball. You'd lean against right in the mid-back, just inside of the shoulder blade on whichever side you're on, and let it go. There we go. Okay, so what you notice is that she's getting looser and looser through this upper chest. Unfortunately for her, she was a massage therapist, she really got her upper body stiff. And so she really needs to do this a lot, all the way up and down for about 4, 5, 6 ribs of doing this. And it's just the lower down you go for the ribs, the farther the head comes to the side to make that be the rib that is affected. So side bend and rotate, right? And so now I'd be down at about rib 6 in the back on the right to take care of that. But that's what you do at home, and then what you'll notice is now she's level. Now if she went to the gym and she were videotaping herself, she would see a much more even lift posture technique. So it really is about placement of ribs and what their orientation is. The ribs actually insert in between 2 vertebrae, and you can lock the vertebra. And that's why you see this problem. So that flexion extension motion that you see in your lifting technique is going to be off because the vertebrae are locked in either flexion or extension or side bending, and they just cannot move like they're supposed to. So you don't move evenly up and down. You're getting this sideways or curvature, what we would call it, dynamic scoliosis. Okay, click like, and we'll see you in the next video.